Good morning, dear juniors. Today we will discuss a very important topic in thorax, that is arterial supply and venous drainage of thorax. So, I will be mainly discussing arch of aorta and azygous venous system. Arch of aorta and azygous venous system. So, I will be covering the entire aspect, that is arterial supply of thorax and venous drainage of thorax. So, I will suggest you to take out your copies or your tablet and to draw along with me, because in anatomy what more matter is that you should draw well labeled and neat diagrams, because you will fetch more marks by drawing these diagrams. So let us select the red color for arteries, and I will suggest you to draw along with me. I will draw it very quickly. And I will suggest you guys to draw along with me so that आप लोगों की भी प्रैक्टिस हो जाए और आप इस लेक्चर से कुछ सीखें बेसिकली. तो इसलिए आई विल सजेस्ट यू टू ड्रॉ. Okay, so now let me draw a diaphragm for you so that I can differentiate it. I can differentiate thoracic aorta from abdominal aorta. So I will be mainly talking about thoracic aorta. Okay. So now who will tell me the three branches? We have three branches of arch of aorta. Three branches of arch of aorta. The first branch of arch of aorta is left subclavian artery. So label along with me, left subclavian artery. This is first branch of arch of aorta, left subclavian artery. Second branch is left common carotid artery. Left common carotid artery is the second branch. And third branch of arch of aorta is brachiocephalic trunk. So this is brachiocephalic trunk. Brachiocephalic trunk, which itself has two branches, right subclavian artery. Label along with me. See, you have to draw and label right subclavian artery. And this is right common carotid artery. If the question in exam comes like draw the arterial supply of thorax, so that you can easily, or for that case write the arterial supply of thorax, so you can easily draw this diagram and you can get marks. Right common carotid artery. Okay, so an easy mnemonic for you to memorize the branches, three branches of arch of aorta. Bachelor of Science, left Bachelor of Science. So एक पर्सन ने बैचलर ऑफ साइंस ज्वाइन करा और फिर फाइनली उसने लेफ्ट कर दिया. सो लेफ्ट बैचलर ऑफ साइंस इज द निमोनिक यूज फॉर थ्री ब्रांचेस ऑफ आर्च ऑफ एओर्टा. सो बी से ब्रेकियोसेफेलिक ट्रंक, ब्रेकियोसेफेलिक आर्टरी. देन एस से सबक्लेवियन. कौन सी सबक्लेवियन? लेफ्ट सबक्लेवियन, बिकॉज उसने बीएससी बैचलर ऑफ साइंस जो है छोड़ दिया है. बीएससी इज द डिग्री फॉर बैचलर ऑफ साइंस. C से left common carotid. So this is an easy mnemonic for you guys, because many a times a student actually get confused that whether we have to write right common carotid, right subclavian, or left common carotid or left subclavian when they asked the branches of arch of aorta. So an easy mnemonic for you. Now let's see further. From the left subclavian artery itself, we have costocervical trunk. So we have costocervical trunk. And from costocervical trunk and another branch called as superior intercostal artery arises. Superior intercostal artery arises. So we have costocervical trunk and superior intercostal artery. So again an easy mnemonic for you to memorize the branches of left subclavian artery, that is computer science. Computer science. So from C stands for costocervical trunk, and from costocervical trunk, what branch is coming? Superior intercostal artery. So superior intercostal artery is indirect branch of subclavian artery, left subclavian artery, and we are mostly concerned with these branches. Now let's see the arterial supply of thorax. So from arch of aorta, 3 branches are coming, and from left subclavian artery, costocervical trunk is coming, and from costocervical trunk, superior intercostal arteries are coming. Okay. Now descending thoracic aorta gives posterior intercostal arteries, one in each intercostal space. So descending thoracic aorta is giving posterior intercostal arteries, one in each intercostal space, while first and second posterior intercostal artery arise from the superior intercostal artery. So it is arising from this superior intercostal artery. So first and second posterior intercostal artery are coming from superior intercostal artery, which is itself coming from costocervical trunk, which is itself coming from left subclavian artery, which is itself coming from arch of aorta. So first and second posterior intercostal artery is indirect branch of arch of aorta, while now let's draw the third, fourth, fifth, sixth, seventh, eighth, ninth, 10th, 11th posterior intercostal artery and one subcostal artery. So what is this? One subcostal artery. So this is a well labeled diagram of arterial supply of thorax. 3rd to 12th posterior intercostal artery arises from the descending thoracic aorta. So I guess you must have been familiar with this topic now. Second topic is venous drainage of thorax. Venous drainage of thorax. Venous drainage of thorax. So let's draw along with me. Guys, you need to draw along with me and label along with me, and I hope you must have been drawn the arterial supply of thorax. Actually, thorax drains into superior vena cava via the azygous venous system. Okay, so on the right side I am drawing azygous vein. On the right side I am drawing the azygous vein. And on the left side I will draw hemiazygous vein and accessory hemiazygous vein. Actually, azygous vein, hemiazygous and accessory hemiazygous vein itself drains into azygous vein only. So you need to draw along with me so that you will get good marks in exam. Okay, so I have completed the diagram. Now let's label it. Azygous vein actually on the right side, azygous vein is present, and azygous vein is draining the blood of the right thorax and actually even the left thorax into the superior vena cava at T-fold level. So what is this? This is superior vena cava, and azygous vein is draining the blood of left and right side of the thorax, both right and left side of the thorax, into superior vena cava. These are brachiocephalic veins. Brachiocephalic veins. So, and here hemiazygous veins, these are draining the lower intercostal spaces, and accessory hemiazygous vein, it drains the upper intercostal spaces. Both hemiazygous and accessory hemiazygous vein drain into azygous vein. Actually, they pass behind the heart and drains into azygous vein at T8 vertebral level. So they are draining at T8 vertebral level. And here T4 vertebral level. So azygous vein, actually how it is formed, let us see the formation of azygous vein. Right ascending lumbar vein from the abdomen reaches at T12 vertebral level and joins right subcostal vein to form the azygous vein. This is a diagram. This is a schematic diagram. And now right ascending lumbar vein reaches T12 vertebral level and joins the right subcostal vein to form the azygous vein. Azygous vein passes the diaphragm at T12 vertebral level along with the aorta. So along with the aorta is present on the right side of the vertebrae, and it enters through the aortic hiatus in the diaphragm. But this is not always the case. Azygous vein can also sometimes pass through the diaphragm by puncturing the right crus of the diaphragm. So the azygous vein moves upward along the right side of the thoracic vertebrae. The right upper and lower posterior intercostal veins, the right upper and lower posterior intercostal veins drain into azygous vein as it moves upward into the thorax. And finally, the azygous vein is draining into superior vena cava at T4 vertebral level. Similarly, hemiazygous vein and accessory hemiazygous vein. So how hemiazygous vein is formed? Left ascending lumbar vein and left subcostal vein form the hemiazygous vein on the left side. Now hemiazygous vein drains the left lower intercostal spaces, and accessory hemiazygous vein drains the left upper intercostal spaces. And I have made the schematic diagram. The hemiazygous vein and the accessory hemiazygous vein cross the midline behind the heart at the T8 vertebral level and drains into the azygous vein. Left superior intercostal vein. Let's see left superior intercostal vein. It is from left second and third posterior intercostal vein. See, left second and third posterior intercostal vein from left superior intercostal vein. It is draining into brachiocephalic vein. See, left superior intercostal vein is draining into left brachiocephalic vein formed by the union of left subclavian vein and the left internal jugular vein. Right superior intercostal vein, it is formed from right second and third posterior intercostal vein, which is draining into azygous vein. So it is not the case in the right side. In the right side, the second and third posterior intercostal veins are draining into azygous vein, while in the left side, the second and third posterior intercostal veins are draining into brachiocephalic veins. First posterior intercostal vein on either side, first posterior intercostal veins are draining into brachiocephalic vein on the respective side. ठीक है? Let's label this. So I have completed the diagram here. Azygous vein drains into superior vena cava at T4 vertebral level, and superior vena cava opens into right atrium at T5 vertebral level. It is open into right atrium at T5 vertebral level. So these vertebral level are very important from the exam point of view and also from your MCQ point of view. So I have completed the arterial supply and venous drainage of thorax. Let us revise what we have studied till now. So arch of aorta has 3 branches. Bachelor of Science. So brachiocephalic trunk, left subclavian artery and left common carotid artery. From the left common carotid artery, costocervical trunk is coming. From the left subclavian artery, costocervical trunk is coming, and from the costocervical trunk, superior intercostal artery is coming. Now, venous drainage of thorax. Azygous vein present on the right side. Accessory hemiazygous and hemiazygous veins are present on left side. They drains finally into azygous vein at T8 vertebral level. Azygous vein drains into superior vena cava at T4 vertebral level, and superior vena cava finally opens into right atrium of the heart at T5 vertebral level. So this is all for today, guys. Thank you.